everyone. I'm Carlika Span, and we are coming to you from the hub, downtown Mount Vernon, for Spero Family Services. As a team member of the Spero family, I'm super excited to be bringing some amazing chats to you guys to not only bring awareness to our community and surrounding areas, but also to any of the followers who might be viewing. This week, we are chatting about Black Maternal Health, as it is Black Maternal Health Week. So I have two amazing guests with me who are professionals in the medical field, and we're going to dive right into it after I introduce them. So, Jaime, you want to go first?
Sure. My name is Jaime Richardson. I am a midwife, home birth mostly. I'm a supervisor here at Spero Family Services for the Parents as Teachers program. I'm a lactation consultant, and I also have my doula certification.
Awesome. Thank you so much. Chastity Mays.
So I am a certified birth doula. I have my own business. It's called Hathor Doula Services. And I am also co-administrator for the Little Resource Center in Carbondale. And it is in an emergency diapers, wipes, formula, car seats resource center for families.
Okay. Thank you both so much for sharing. Before we actually get started with a full conversation, would both of you like to just kind of dive in however you feel comfortable to give us some background on what a doula actually is?
Yeah, so a doula is emotional, physical, and education support for families. That is the definition, right?
Okay.
It is so much more than that, but I think as we talk, I'll be able to tell you everything I do for my clients.
Okay, awesome. Jaime?
Yeah, those things. And then I think I would just say that just a reminder that it's not a medical. So as doulas, we aren't doing any type of medical interventions. We are really just there to support moms and families.
Okay, I love it. So, as a Black woman myself who has multiple children, and all my birthing experiences were very different, didn't have the same healthcare provider with each one of those. So, you guys kind of know how that goes, different personalities and things like that. Let's start off with talking about Black Maternal Health Week and why the two of you find it so valuable to kind of bring awareness to the community and why it's so important.
So it's so important because in the US, Black women are 2 to 3 times more likely to die during childbirth than their white counterparts. And that is what keeps me being a doula, is to support the Black families as they're coming through their birthing journey. So I want to teach them how to advocate for themselves. I want to teach them how to educate themselves, and I want to stand beside them and support them while they're in the hospital. So if we have any issues come up, we can help save that woman's life.
Absolutely. I love that. Advocacy is something I definitely want to dive into a little bit later. Jaime, you want to piggyback off that?
So for me, I think I really learned a lot about Black maternal health when I was in school to become a midwife. And like Chastity mentioned, the statistics for Black women when they're giving birth and even in the postpartum period are just, it's mind blowing. And I just think that, as here in the United States, we are one of the most medicalized, industrialized countries in the world. And it just blows my mind that we still have horrible outcomes for the Black community. And I just want to be able to, work with my counterparts and be able to do some things to make changes for those women and families.
Okay, awesome. Before we switch gears, because you brought up advocacy, and I want to spend a little bit of time there, if that's okay with you guys. And I shared with you before, because we had the opportunity to chat on a Zoom before today. Chastity, I was just sharing with her that, like, even in my 40s, I just recently, kind of like late 30s, early 40s, became comfortable advocating for myself in the doctor's office. If something's not right or something doesn't sit well with you. Now, I'm a very outspoken person, but I mean, digging a little bit deeper, kind of interviewing my OBGYN or my GYN just to make sure that we're both a good fit for each other. So can we talk a little bit more about advocacy and just asking the right questions to make you a little bit more comfortable?
Yeah, so I'll tell you, one of the first things I do with my clients is I start with a birth plan, because what I find is that families really don't know where to start when they start on their birthing journey. So that birth plan is going to have everything that they want and some things they may not have thought about.
Okay.
So like, do you want to breastfeed? Do you want to bottle feed? What type of birth do you want? Do you want to be able to move around the room? Do you want your partner to cut the cord? Those types of things being on that birth plan, you take that to your doctor's appointment. If you give that to your provider, that opens up the chance for them to talk to you about those things, and that opens up the conversation. One other thing that I tell my clients is it's really about the way you approach things. So, would you like an IV? A simple no, thank you goes a long way. So, I think it's about the way we approach things when we're in this situation and how we handle providers. But I just teach my clients, like, advocate for yourself. I'm here to support you. The only way I'm going to step in is if we have a life or death situation. Teaching clients to advocate for themselves, I feel like, is really important, like during the birth journey. But I always tell moms, I want you to learn how to do this now because you need to learn how to do it for your child.
Absolutely. Absolutely.
Yeah.
Jaime?
One of the things that I always talk to clients about is asking questions of their providers. When I say, your provider comes in and they say, we're going to do this. First of all, they really should be asking. They should be offering information. So I encourage our clients to say, okay, what are the risks to that? What are the benefits to that? What are my alternatives to those options? And then what if I choose to do nothing? So teaching them to ask questions and to advocate for themselves. And then I think also what's really important is I've reminded clients before, you do have the right to fire your provider and move on to someone else. It's not always a good fit. And I think that unfortunately what happens is even sometimes, clients will interview providers and they'll say, this is what I want for my birth plan. I don't want to do this and I don't want to do that, or I do want to do this. And, they get some providers that, will go along and they'll say, yeah, that's fine. And then as we, gravitate towards the end of the pregnancy and things are beginning to happen, then, sometimes we can kind of start getting some backpedal on what we agreed to. And so, yeah, it's very difficult to stand up for yourself, I think.
It is. Yeah. And if I could just add a piece of information to that, because something else we got to chat about prior to today was when you're on Medicaid, a lot of younger moms, not just younger moms, but even myself, as a 19-year-old or 20-year-old pregnant mom going through all of, pregnancy appointments, things like that, resources sometimes are limited when you're on Medicaid. So let's talk about that a little bit, because it could be a barrier, it could be a challenge to give you a reason to maybe not want to speak up because your resources are already limited, or maybe you have to travel 3 hours to get to another provider. Let's talk about that, and maybe some supportive commentary for mothers who might be on Medicaid.
So honestly, it does not matter whether you're on Medicaid or not. I teach my clients that when you go in that hospital, that's your space. You are giving birth, you have choices, like Jaime said. I have clients who go into that room, they honestly just use the space. They don't even have an IV. Okay. That's how much of a choice they have. So we can use LED candles, we can bring focus pictures, we can have a playlist of music, we can bring those shades down. So the thing that you need to know is it's your birth the way you would like it, no matter where you're giving birth at, whether it's at a hospital, whether it's at home. And that's just my experience, but I'm going to teach my clients that those are things that we can do. Another thing I wanted to talk about, what Jaime said, is that I always tell my clients you can switch providers.
Okay.
So if there is a time period where you're 30 weeks pregnant and you tell your provider something and they say, no, I'm not able to do that, switch. It's able to happen, and don't feel like you cannot do that. So it's just so important for people to understand it's your birth, it's your choice, it's your family.
No matter what.
No matter what.
No matter what.
Yeah. I love that. Yeah. You want to add anything, Jaime?
Oh, I think, I could probably go on for days about, just people being able to, advocate for themselves. It's just so important. It's hard. It's hard
it is.
It would even be hard for me, when you think about doctors and providers as a whole. I think we all kind of have this, assumption that they know best.
Yes, because they're the professional.
Exactly. Like, and so they should know everything,
right. And
maybe we don't know anything, but it really should be more about conversation and, planning and agreements. And, I do always say, and I'm sure you probably tell your clients this too, Chastity, is when you have a birth plan, that's fantastic. We make birth plans with all of our clients. Also to think about helping them to be flexible. You know,
Right.
for example, you know, if you don't want an IV, under normal circumstances, a normal labor, everything's progressing well, there's no issues. That's yeah, we don't need an IV. But you know, if we run into an instance where now we're getting into a little bit of trouble or something like that, and it becomes a necessity, being able to have those conversations with your clients about being flexible, but you know, asking, okay, this was what we decided on my birth plan, so you know, why are we changing now? Is there a need for this? Do I have, it's just a continuous conversation.
Absolutely.
And I think just keeping the dialogue going with clients and providers is one of the best ways to get through those situations.
I love that. And we're talking about you know, things that could go wrong, being proactive. But let's put things in reverse really quick. When your provider is initially introduced to you, wouldn't you say that that's probably the ideal time to ask some questions, maybe kind of get a personality fit, you know, to see if we're going to have a good rapport with one another? Because sometimes, even if you just have a bad vibe, you know, you might think, I think I want to try someone else. So up front, before anything ever has the opportunity to go wrong, let's share some commentary on that. Like, what are your thoughts about that? Really just diving in up front before you even begin building that relationship with your provider.
Well, I'll use myself as an example. So when a family reaches out to me, my consultation is free. And I always tell them that I want them to meet with me. I never let anybody hire me right then.
Okay.
So I want them to talk to me and see if I'm a good fit for their family.
I love that.
Because when I first started being a doula, it would hurt my feelings so bad. I'd be like, oh my gosh, they didn't hire me. What I do wrong? But I'm not a fit for every family.
Exactly.
So what I do is I tell them, let's meet. I want you to go home as a family, decide whether you want to hire me or not. But I also leave them with this. It's not about me being your doula. It's about you having a doula. If you don't choose me, reach back out. I have a whole list of doulas. You go and you interview one until you find the right one. It's the same thing with the OBs and midwives. You find the right fit for your family because every family is different.
Okay.
And that's really important.
I love that.
Absolutely. And I think, you know, when you walk in as a client, if you start that conversation, when you say, you know, hi, you know, it's great to meet you. I'm here, you know, I'm in the market, you know, for a provider. I would like to kind of go through some questions first and see if we're a good fit. Put yourself in the driver's seat first.
I love that.
You know, put that out there, you know, and I think that kind of gives you a little bit of the upper hand because, you know, they're going to be like, oh, okay, this person has done some research. They thought about this. They have some questions and they're going to really take an initiative on, you know, who they're going to hire for their care.
Yeah, I think also in that moment, it'll say a lot about who the provider, you know, not just their personality, but how they will move and, you know, what they're going to be like moving forward.
Yep.
Yes.
Yeah, absolutely. What would you guys say are like the 3 main pillars of doula support?
So the 3 I would say is the education piece is so important. Like I said, some families don't talk about these things. It's like you're going to have a baby and there's so much to that.
Mm-hmm.
And if you have that doula there to kind of help you, just bring it down. You know, like what are the most important things to you? So education is huge. The physical support.
Yes.
So I work out during labors.
Okay.
So that physical support is really important. And then I would say that advocacy piece, teaching them to advocate for themselves. Like you said, these young moms who you're just finding your voice when you're young.
Yeah.
And then you're about to have a baby.
Mm-hmm.
Having someone there for you. Like I'll give you an example. One of my clients, she knew she wanted to have a natural birth, right? She went to her OB appointment. The nurse told her she was crazy. So she wanted this natural birth, and after the doctor's appointment, she called me and she was like, Chastity, they told me I was crazy. What am I doing wrong? Mm-hmm. So if you have the support over here, you can ignore those over there.
Okay.
Right? So it's me supporting her. No, you're not crazy. Everything's fine. I'm here to support you no matter what turns out. And then you have your partner to support you. Then what everybody else says can just be background noise.
Okay. I like that.
Yeah.
Anything you want to add?
I think, you know, the physical, emotional, the education, but then also just being able and like willing to kind of like read your client, but read the room, because there's lots of times where I feel like when I was working as a doula, you know, the mom was really dependent on me to provide that physical, you know, whether it was hip squeezes or counter pressure or whatever. And then I felt like there were other families that I worked with where I didn't necessarily need to be up there doing that, but I could tell their partner how to do the hip squeezes or where to put the counter pressure. I think it's remembering that you're a support for the entire family.
Absolutely.
That mom and that partner and whoever else is
Yes.
in the room. So just being able to, step back sometimes.
Yeah.
And like Chastity said, it's not about me being your doula. It's about you having the experience that you want and feeling like you're supported, whether that means me sitting in the room and just staying back here and helping your family to support you,
Mhm.
or me being right up there and doing everything that you need me to do.
Yeah, I think
Yeah.
it's I would agree with both of you. It's very much a team effort.
Yes.
So while we are concerned about mom, and her choices, it's very much a team effort because that's what makes the process or the actual experience go smoothly.
Yeah.
Would you agree?
Yes, if I could add to that, so I find that partners are very apprehensive.
Okay.
So whenever I have my consultation, the first thing I say is I'm here for you also. And literally I see them relax. They're like, really?
Okay.
And I'm like, yes, I'm here to support you and your partner, whatever you need from me. Some of them hug me. I've had partners cry before, and I'm like, oh my gosh, y'all, like I'm here to support you. And so that's very, very important. And then I think also teaching moms that mom is the focus, right?
Mhm.
But partners going through something too.
Absolutely.
Like they're nervous, they're thinking about baby, they're worried about you. Like you're in labor, what can they do to help you? So it's very important to know that it's a team.
I think that's a perfect segue into my next question regarding the major, or I guess the biggest impact that a doula has on birth. What would you say in your personal experience and all your years of experience? What's like a really major impact that a doula has on birth?
I just think that support piece. I know that the moms that I've served have, like, honestly, I've been in the room sometimes, and for me, it was a bad experience. But afterward, when I go over that birth with the mom is like, it was beautiful, like, thank you so much for being
Mhm.
there, and it was the most amazing birth. I couldn't ask for anything better. In my mind, I'm like, really?
You were thinking something different.
Right?
Yeah.
Were you there with me?
Mhm.
But that piece of just being there as that support made her birth something totally different than it may have been.
Okay.
So I think just knowing that doula can really provide that support, and I think also the empowerment that I see my clients get. So they will tell me like they felt so strong and powerful, and then going into motherhood,
Mhm.
with that is just amazing.
Yeah.
I like that.
Yeah, I think just being there, like you're their biggest cheerleader, because it's when we always like when we hit that transition stage of labor,
Yes.
and moms, and I like to tell my clients that I go, listen, we're going to get to the end of this, and you're probably going to look at me and you're going to say, I cannot do this, and I say, yes, you can, and we're going to talk you right through it, and so it's just kind of being there and just being that. You got this. Just keep breathing. You got this. You could do this. Like you're doing awesome. Just constantly re-encouraging them.
Okay. So I have my own personal question because I didn't really learn about what a doula actually was or doula services till later on. So when I had my first child, not even thought in my mind, I wasn't exposed to it, really didn't know a lot about it. But now that I am a little more well versed on what you offer, plus I have a couple friends who have actually used a doula, and they just felt personally like it was a much more intimate, personal, relaxing, stress-free experience in comparison to your traditional birthing route. And so again, I have not experienced that on my own, but with friends having gone down, that route and the route that they took, would you say that you kind of see that yourself? Not being biased because you are doulas, but would you say that that's a plus, or what are your thoughts on that?
I say it's a plus.
Okay.
I recently had some clients tell me that just me being there, and like she just said, being that cheerleader, the one client described it as she just had a peaceful birth. She said, of course I had contractions, but for me in that moment, I just remember the peace that I experienced.
Okay.
Because I'm there reminding you that I need you to breathe, like constantly, like focus on your breathing. I'm telling you to relax. In early labor, we're just having conversations, kind of keep your mind off of things. The massage, I know the touch, one of the partners told me that the touch was really important to him. So it's just all those things together, I think. And like Jamie said, you're a cheerleader. You're in their
You
ear,
really are.
like supporting them. And really, I say in life, like you could, anything you do, the more support you have, the better experience you have.
Exactly.
So I think just having that person there, being there strictly for the family, is super important.
Having somebody there to normalize things.
Yes.
Normalize, things that they're feeling, or the way labor is progressing, or just different things. There's just lots of things that come up in labor, that might make them a little bit anxious. And, maybe it's something that, the nurse or the provider wouldn't necessarily be apt to stand there and have a conversation with them about. But, we can say, oh, this is totally normal, and that alleviates like a little bit of anxiety, just knowing like, okay, what I'm feeling is normal, what my doula is seeing is normal, because, they've seen lots of deliveries. And so if they say this is normal, then I'm gonna relax.
It's gonna be reassurance.
Yeah.
Absolutely.
Yeah.
As we wrap things up, I would like for you guys, if you don't mind, to just share maybe some of your most joyous highlights, like of your experience. Maybe one of your personal birthing experiences, or maybe a conversation after the fact or prior to the fact with the family. What would you like to maybe highlight, to just share?
I just supported a family on Friday, and it was absolutely a beautiful birth. So I have the advantage of being able to labor at home with my clients.
Okay.
So we labored at home Thursday. I went home, got some sleep. She called me Friday morning. We labored at her house for a while. We were only at the hospital for 4 hours. Okay. Her birth plan was completely natural birth. She got to the end. She said, I can't do this. We talked her through it, myself and her partner. Mm-hmm. She did it. Okay. And at the end, just joyous for her, her partner, and me to be able to support her with what she wanted. So just these, and then I'll tell you, like, Black birthing joy is possible. So me being able to support my clients, and I had 2 clients recently who I talked to about their births, and they had beautiful experiences in the hospital, which is the stories that we're not normalizing, right, about Black birthing joy, because it's possible.
It is.
And I'm going to tell everybody, get a doula. But if you don't want to do it at your birth, get a doula to train your partner to be your doula.
I love that. Offer a little more clarity on that.
So you just meet with me during the prenatal period, and I would teach your partner exactly what to do during that birth.
Okay.
I would teach them birthing positions. We would make your birth plan. We would go through kind of scenarios, like, what would you do if this happened? What would you do? And then those questions, like, super important, how to talk to the providers, how to talk to the nurses. So that's possible.
Okay.
If you don't want me there in that space with you, we can train you up.
I like that. Thank you for sharing. Jamie?
Where'd we get to?
Okay. Highlights, a most memorable experience, and it doesn't have to actually be the birthing process itself. Maybe a conversation, or just what someone was thankful for, maybe, or what someone else, a client, found most important.
I think that it's always nice to hear clients say, like, oh my gosh, I don't think I could have done this without you.
Okay.
But I would say, like, if I have to go back to one of my most favorite experiences, it was part of my journey. It was part of how I got to where I am, because I did, I've been a nurse for 25 years. I always knew I wanted to do labor and delivery, and I've worked here at Spero with the parenting program for the last 23 years. And I had an opportunity to go work up on the labor and delivery floor for a little while. And it just, it was not what I was looking for. Like, I always left thinking, it's like something was just not right. Even when everything went great, when the births went great, when there was no issues, nobody was unhappy about anything, there just was still something. And so then enter in, who ended up being my mentor and the other midwife that I work with in the practice now. And when I went to my first home birth, and I saw, and I got to be there and support that mom through birthing the way she wanted to birth, that was like, then it was like the aha moment. It was like, okay, I have seen birth this way. It never set right with me. And now I know why, because this is what I'm supposed to do. And so I was really called to be, an out of hospital, doula, midwife, so that was kind of my aha moment. So
I love that. And clearly, this has to be your passion. You have to be passionate
It is
about
oh my
what you
gosh.
do, because there's so many highs and lows, attitudes, emotions, all the things. And so, thank you guys for joining me, taking time out of your day. I love that you love this and we're willing to come and kind of share some personal experience with our viewers and myself, just to get awareness out to our community. I hope that you might think about coming to join me again, because I already see that there's so many things that we could actually chat about to bring awareness. So thank you guys for watching and joining us in this segment. Here at Spero Family Services, our foundation is hope, help, and healing. So I'm excited to bring more chats your way. Thank you guys for watching. We'll be back with you soon.